Hello everybody and welcome to the University of Queensland Faculty of Health and Behavioural Sciences Alumni Webinar Series. My name is Paul Purcell and today we'll be joined by Dr. Gregore Mielke from the UQ School of Human Movement and Nutrition Sciences. Dr. Mielke is a UQ Development Fellow and has worked with the Centre for Research on Exercise, Physical Activity and Health Researchers, and his interest is in measuring and understanding inequalities in population health, particularly in relation to physical activity and sedentary behaviour. I begin today by acknowledging the traditional owners and their custodianship of the various different lands on which we all meet. On behalf of the university, I pay our respects to their ancestors and their descendants who continue cultural and spiritual connections to country. We recognise their valuable contributions to Australian and global society. For those of you joining us live today, you're encouraged to ask questions during the webinar via the Q&A function, which you can find at the bottom of your screen. We will endeavour to answer these at the conclusion of the presentation. Additionally, this webinar is being recorded and will become accessible via the HaBS Alumni webpage early next week. We'll send out an email to you with the link to this, as also it contains a link to the previous episodes within this series. And now, it gives me great pleasure to introduce Dr. Gregore Mielke.
Hi, Paul. Thank you. Thank you, everyone, for attending this seminar. Thank you for the introduction as well. Can you just confirm that you are hearing me? You can listen. Okay, thank you. So thank you for attending this webinar. For this webinar, my idea is to talk with you a little bit about how exercise or different patterns of physical activity accumulated throughout the life course, the impact on health. So I decided to outline my presentation today, and based on the UQ branding that explores the idea that actually exploring some of the big unknowns that are facing our world today. So what I decided to do here is discuss with you a little bit about what we know and what we don't know about physical activity, about patterns of accumulation of physical activity. And that's going to be in the first part. And then in the second part of this presentation, I'm going to share with you some of the research that our group is doing to try to embrace some of the complexities of the accumulation of the patterns of accumulation of physical activity, and how our group is trying to respond to some of these complex questions on how different patterns of accumulation of physical activity are related to health across the lifespan. So in terms of what we know or what we don't know about physical activity, I'm going to start with what we know about physical activity. And you can see that the screen here, the physical activity guidelines for Australia. And probably most of you know about these guidelines much more than I do. But we know that the national and international physical activity guidelines, they recommend adults to accumulate between 150 to 300 minutes per week of moderate intensity physical activity, or also accumulate 75 minutes of vigorous intensity physical activity, or an equivalent combination of these activities. What we don't know and what I think is really fascinating about these guidelines is that actually in real life, they accumulate, or people who achieve these physical activity guidelines, thresholds, they accumulate their physical activity in many different ways. So if you think about your life and the activities that you do, some of you might do 30 minutes of moderate intensity physical activity on 5 days each week. That is, for example, walking to and from work. While others might do 75 minutes of vigorous intensity physical activity in one single day. For example, playing a competition of tennis in a Sunday morning here in Brisbane, or going for a 3 hours walk, a bush walk in a weekend as well. So this is really interesting because we have a guideline that suggests this approach that is a one-size-fits-all approach, but in real life, people accumulate physical activity in many different ways. And because now we can measure these different ways of accumulating physical activity with a much more precise way, we can investigate how these different patterns of accumulation of physical activity, they relate to health. Another interesting point, and this slide here describes one example that I really like, that is how physical activity is accumulated or varies, or the accumulation of physical activity varies within the day and between days as well. So this graph here shows how physical activity is accumulated within a day, and we can see here within day variation. And this is data from a population where we have an average. But if we would look at it in a more close way, if we would look at individual data as well, we would have, or we have actually, some people that accumulate physical activity, all their physical activity early in the morning, and then they spend the whole day sitting. Or some people accumulate that all physical activity late in the day, and some people that they just spread their physical activity across the day. The same is true when we think about the distribution of physical activity across the week. And we have people that spread their physical activity across the week. And we have people that accumulate all their physical activity in one single day. And the beauty of that is that maybe some health outcomes, what we need to understand is how different health outcomes, they are related to different patterns of accumulation of physical activity, or different patterns of physical activity at all. So these are some of the unknowns that we have in our field. And our research group at the School of Human Movement and Nutrition Science, our CREXPER group, we are trying to embrace and developing a research program that that is used to respond to some of these questions. And now in the second part of this talk, I'm going to share with you two studies that we conducted here with population-based studies, where to some extent we look at these different ways of accumulating or doing physical activity and how this is related to health. The first study that I'd like to share with you is this study where we look at the participation in sports, recreational activities, and incidence of hypertension, diabetes, and obesity. Before I start and talk about this specific study, there is a really nice story that I'd like to share with you about this study. So actually, this study started in a Friday like today, in a happy hour, when I was having a really nice chat with a good friend that loves cycling. And we are in a happy hour in a pub having a glass of wine, and she was trying to convince me that cycling is the best exercise that you can do. And I was saying, no way, because here in Brisbane it's impossible to cycle because it's too hilly. And instead, you should go for a running, because running is much better for your health than cycling. And then we were arguing with that, and then we decided to investigate more about which sport or which recreational activity is better for your health. And surprisingly, we observed that in the literature, there is not many population-based studies that investigated that sort of research question. And we have global actual plans on physical activity that use an approach that encourage participation in sports and recreational activities as a way to decrease population levels of physical inactivity. But what is interesting, as I said, is that these global plans, even though that they bring the idea of sports and recreational activities, we don't have many evidence base that support the idea that incentivizing sports and recreational activities is good for your health. So therefore, the aim of this study was to investigate the associations between participation in sports and active recreation with incidence of hypertension, diabetes, obesity in a large cohort of mid-age Australian adults. We analyzed, to respond to this research question, we analyzed data from the Habitat study. So this is a population-based study, cohort study of mid-age adults living here in Brisbane. In 2007, a multi-stage sampling process was used to select a representative sample of adults living here in Brisbane that at that time were aged 40 to 65 years old. In 2007, that was the baseline, a mail survey was sent to the cohort, and over 11,000 participants, they responded to this questionnaire. Participants, they reported participation in 11 sports and recreation activities in the last 12 months, and they had these 6 response options. For the analysis that I'm going to present here, we grouped participations in these 3 categories: none, some, and at least once participation at least once a week. And I'm going to report only the comparisons between never or none and at least once a week. Participants responded as well whether or not they had specific long-term health conditions. So hypertension and diabetes were defined as positive answers to this question that you can see here in my screen. Participants, they were asked to indicate yes to those conditions that have lasted for at least 6 months. They also reported a height and weight, and then we were able to calculate BMI and calculate the occurrence of obesity in this sample. All these participants, they were surveyed again by mail in 2009, in 2011, and 2013. And all this information and other sociodemographic information, they were collected as well. To investigate how sports, so participation in sports and active recreation was linked with these health conditions, we used a classical epidemiological approach where we linked the information that was collected in 2007 with for sports and active recreation with occurrence of these 3 conditions 2 years later. So we excluded all participants that had hypertension, diabetes, and obesity. And in this case, we are able to identify the occurrence of new cases of hypertension, diabetes, and obesity in this sample. In terms of results, this graph here shows the participation in sports and active recreation at least once a week in this sample at the baseline in 2007, when they were on average 51 years old. As you can observe here, home-based exercise, they were the most reported activity in this cohort. Followed by weights and running or jogging. So I just wonder, these might be the nice people of this cohort, the runners. So in terms of results, in terms of health outcomes, this figure here gives you an overview of the cumulative incidence of hypertension in this sample. Over 6 years, 15% of participants, they reported hypertension. So we can understand or interpret this result as the chance of someone that didn't have hypertension at age 50, the chance of developing hypertension over 6 years was nearly 15%. We observed that overall, reporting sports at least once a week was associated with 15% reduction on risk of incident hypertension. This varied by different sports, with running at least once a week presenting the strongest risk reduction on around 30% risk reduction for hypertension. From 2007 to 2013, there were 3% new cases of diabetes. As we can observe in this figure here, overall, reporting sports at least once a week was associated with a 22% reduced risk of diabetes. As observed in this figure here, the associations varied by sports participation and presented a large variability. For diabetes, cycling was the activity with the highest risk reduction. So those who cycled had 40% reduction in the risk of diabetes. 1 in 9 participants, they develop obesity over 6 years, as we can observe in this figure here. And sports participation at least once a week was associated with 17% risk reduction on developing obesity, with the highest reduction associated with participation in tennis and cycling. This figure here is a summary of our results and compare the associations between sports and active recreation with hypertension, diabetes, and obesity. So in summary, from the list of activities investigated, with exception of golf, team sports, and swimming and long balls, all other activities, they were associated with risk reduction of at least one health condition. So it's important to note that participation in running, that was my question, for example, was good for hypertension and diabetes. And participation of cycling was good for diabetes and obesity. So that was our argument early in this, or the discussion early in this presentation or in this study. But it's important to note that participation in weight exercise at least once a week was associated with reduced risk of all the 3 health conditions. So actually what I learned from this study indeed was that I never have to argue with my wife because she loves weight training. So that is the response, the conclusion of this study that we started to do to discuss whether or not running or cycling were the best activities to do. Jokes aside, what is really interesting about this study is that, as you remember, I said that golf was not associated with any of the health conditions. When we look at the levels of physical activity of these participants or how much they reported physical activity, we observed that those that reported golf at least once a week, they also reported high levels of physical activity. And if we look at these bars, the blue and purple bar here, it represents the proportion of participants that reported golf that actually met the physical activity guidelines. And as you can observe here, those who reported golf, more than 90% of them reported had high levels of physical activity or met the physical activity guidelines. And home-based exercise that was associated with some health outcomes, 25% of participants, they did not meet the physical activity guidelines. So this result just highlights the importance of understanding this complexity and embrace these different patterns of physical activity during the life course. The second study that I'm going to share with you, that I'd like to share with you, is this study where we investigated trajectories of physical activity and health costs in mid-age women. So in this study, we use data from the Australian longitudinal study of women's health, the mid-age cohort. That is a cohort that started in 1996. And that includes women from a representative sample of Australia that were born in 1946 to 51. And now these participants, they have been surveyed since 1996, and they respond surveys at 3 years intervals. So we use data from this cohort study to investigate how changes in physical activity during the life course are related to health outcomes. So this is important because we know that physical activity, it varies across the lifespan. And we know that we have many different points of our life that we might be more or less likely to be active. So what we'd like to know is how much the variation in physical activity, how much physical activity changes across the lifespan, and how much this change in physical activity actually is related to health outcomes, in this case specifically to health costs. So in terms of results, we analyzed data from nearly 7,000 participants in the Australian longitudinal study of women's health. We analyzed this data last year. And as you can observe here, in 2001, when these women, they were in their 50s, 51% of participants, they met the physical activity guidelines. They were considered active. When we look at data 6 years later, in 2007, we observed that there were some transition or some change in physical activity. And as you can see here, some participants that were active, they became inactive, and vice versa as well. Some participants that were inactive, they became active. So overall, 35% of participants, they changed their physical activity status. When we look again in 2013, this is the picture that we have. So from 2001 to 2013, only 32% of participants, they were always active, and 15 or 16% of participants, they were always inactive. But as you can observe here, we have different participants that had different patterns of trajectories of physical activity. Some that were active, inactive, and became active again, and vice versa. And our research group is trying to respond or explore how these different patterns of accumulation of physical activity during the life course or during the lifespan is related to health outcomes. As I said, for this study, we investigated how these different trajectories of physical activity, they were related to health costs. For this, we used data that are collected on health costs from the MBS and PBS between 2013 and 2015. And what we observed was that the average health cost with MBS among those women that were always inactive was a little bit higher than $4,000 in this 3-year period. And then among those women that were always active, that was the cost with MBS. And we observed the same pattern here with higher costs among those participants that were always active. So overall, we observed that maintaining that active physical activity status was associated with 40% reduction, a lower MBS, and 30% lower PBS costs over 3 years in Australian women. What was also important to note is that those participants that were active in at least one survey, or those that became active, that were inactive originally and became active, they had also lower health costs in terms of MBS and PBS when compared with those that were always inactive. So this message or this result just flags the idea that it's never too late to become active, and especially when we think about health costs. So to finalize this presentation, and in terms of the take-home message that I'd like to take from this data, is that first, that we need to embrace this complexity and understand that this one-size-fits-all approach, we need to think about this one-size-fits-all approach and when thinking about physical activity, and understand that physical activity changes across the lifespan. And we need to understand how physical activity changes and what is the impact of physical activity. What we observed, or what our research group has been observing in the population studies that we are working, is that in these large cohort studies, several recreational sports or patterns of physical activity, they are associated with lower risk of hypertension, diabetes, and obesity, which results in lower health costs as well. Not only these conditions, but it results in lower health costs. These findings, they support the notion that improving participation in different sports and physical activity in mid-age may have important health benefits. But what I really would like to highlight here is that in my point of view, these results, they support the idea that current efforts, they have to create opportunities to promote wider participation in sports and recreational activities in mid-age adults, but especially activities that might bring joy. And actually these results, they support the idea that in fact, you can do activities that you would like to do, or you have a range of activities that you can do to improve your health. And the last point is that as we observe, it seems that it's never too late to become active and to have some health benefits. With this, I just would like to thank you, our research group and the research group and some people that were part of this presentation, providing data or with the studies that I present here, and our Center for Research on Exercise, Physical Activity and Health as well. Thank you again, the HaBS, the UQ Health, and for this opportunity. And I'm open for questions. So if you have any questions, you can ask now here, or feel free to contact me later by email or Twitter. Or so I would be really pleased to share that and respond to that. Thank you very much, Paul.
Thank you very much, Gregory. That was really fascinating. And one of the big takeaways I took away very early on was on that one of the first graphs you showed us, the day that had the least amount of activity was Friday. And given that's today, I feel like we should wrap this up reasonably soon so people can get out there and change that trend. But there's a few questions that have come through. So what I'll do is I'll just start off if you've got a moment. And one of the first ones that's come through is actually asking, they found fascinating what you're working on. They wanted to know, so what are your team working on next?
So next, we are trying to understand a little bit more about, I'm just going to move up here. So next, what we are trying to do is to, as I said, embrace this complexity in the ways that people accumulate physical activity. And we are really interested in understanding some of common patterns of physical activity. For example, one pattern that we call the weekend warrior pattern. That is, that was my pattern of physical activity for a long time. It's just doing nothing during the week and play soccer for a long time during the weekend. When we are trying to understand whether or not accumulating a large amount of physical activity in just 1 or 2 sessions is beneficial for our health, or that is one thing that we are trying to do now. And we also want to understand more about those, how changing physical activity across the lifespan, that was the second part of my presentation. How do that variation influence health, but in other age groups as well. So we had that with mid-age. So we are trying to understand that early on in adulthood, or in I'm working now in a study that we are looking the transition of the physical activity change in the transition from adolescent to adulthood. So this is what we are trying to do now.
That's great, thank you. That'll be fascinating to see what comes of that. One of the questions we've had that's come through, and I sense this might have actually been touched on in one of your graphs to a certain extent, but they might be after an expansion and such. Do you think that there is a difference in terms of the health benefits between team and individual sports? And follows on to say maybe team sports provide better mental health outcomes due to social interaction. I guess they're two different things, but from I guess first of all, from a health benefits perspective, what's the data shown you?
That's a really important and interesting question, Paul. And indeed, actually, my short response is yes, there are different effects. What we show here was some outcomes that are more cardiovascular and metabolic outcomes. And for these outcomes, maybe like the idea of physical activity in a more like movement perspective or energy expenditure might be important, might be the case. But for mental health outcomes, I think we need to embrace the idea of physical activity in a more holistic way, actually. and then team sports become really important in my point of view, because then we have the socialization about physical activity. If we would think I would say that most of people, they do physical activity much more for the social aspect than for the metabolic and cardiovascular benefits of physical activity. So that is one question that we are trying to respond as well, is to understand how these different patterns of accumulation of physical activity, they impact in different health outcomes, like from mental health outcomes to more traditional and hard outcomes, let's say that way.
Okay, that's great. And we might wrap up with just one last question. And thank you once again for your time. And thank you everyone that's joined us today. How much physical activity in one day of the week do you think is important for your health?
What the evidence shows to us is that something is better than nothing. And actually the largest reduction in the risk of most of the health outcomes is when we move from doing nothing to doing something. So, and then that is the main message, I'd say. In terms of how much physical activity in one day, I'd say the amount of physical activity that you can do in one day. There is no, you need to do this. And what we have so far, what the evidence that we have is that seems that the volume of physical activity is important. So as soon as you accumulate that in one day or 2 days or spread over the week, that would be fine.
Well, that's fantastic. Thank you very much once again, Dr. Gregore Mielke. It's been fascinating listening to everything you've had to say, and we've got some lovely comments from people expressing those thoughts as well. And it's actually really good to see, just from an anecdotal point of view, that the age-old debate between cyclists and runners has yielded a positive outcome in the fact that it's led to this research. So we're really grateful for you joining us today. And on behalf of the University of Queensland, we thank everyone that's joined us as an attendee. As mentioned previously, we'll send out a recording to this, which will probably come out early next week. But for now, we'll wrap up and say thank you once again, Gregory, and thank you all and have a great day.
Thank you, Paul. Thank you, everyone.
Goodbye.
Bye-bye.